Welcome to the HERHealth podcast, transforming health for women and girls at risk, where we empower women and girls to take charge of their health and well-being. Join us as we shine a spotlight on issues affecting women and girls' health and explore ways to create positive change. Get ready to be inspired and empowered as we discuss health, advocacy, and empowerment for women and girls at risk. Please be advised that this podcast may cover sensitive topics such as gendered violence. We understand that these discussions can be difficult to listen to. If you feel uncomfortable or need support, we encourage you to prioritize your well-being. Consider exploring our other podcasts if these topics are triggering for you. Resources can be found in the description.
Well, welcome to the HERHealth podcast, where we highlight voices, research, and ideas driving change in health and social services and systems for women, girls, and gender diverse people affected by violence and adversity. I'm your host today, Alexandria Lazochek, and in this episode, we'll explore violence as a public health issue, the epidemiological data that shapes prevention efforts, and the critical role of the Brazil's unified health system, known as SUS or SUS. We'll also dive into the intersectional strategies, ongoing challenges, and the international relevance of Brazil's approach. I want to introduce Mayra today, and let's get started. So, Mayra, can you kind of start by sharing how violence is understood and addressed as a public health issue in Brazil?
Sure. Thanks for having me here. So I've been studying, researching, and working on the topic of violence for a while now, from public health perspective, and specifically from the lens of health surveillance. So for many people, violence is still seen mainly as a justice or a public security issue. But from a public health point of view, we look at prevention, early detection, care, and the long-term impacts on communities. So violence causes physical injuries, but also deep psychological, emotional traumas that affect families and future generations. So that's why the health system must be involved. It's often the first point of contact for victims. So people need to go to the hospital or need health assistance. And there we can identify patterns through surveillance, and it has tools to coordinate care and prevention. So in Brazil, we treat violence like any other serious health problem. Actually, we treat, but few people they don't. So we teach about them. We teach about this to them. So we monitor, we notify, and we use those data to plan actions and to protect people mainly.
Thank you so much for diving into that. In your webinar, you really did talk about the costs beyond financial and how it impacts victims emotionally and in other ways as well. So I really appreciate you talking about that again. I wanted to ask about the role of surveillance data and how it plays in informing violence prevention policies and practices in Brazil.
Yeah. So here, health surveillance is central. So as I told before, it's a systematic approach. We collect the data through the form, we analyze, we interpret, and we disseminate information and use to guide our decisions and our actions. This is the principal source of the analysis. So in Brazil, violence is a condition that must be notified, as I told you before. So when a case is notified, it triggers two things: immediate action, that is to protect the victim, but it also to insert these cases in SINA, which is our health information system. So we can do epidemiological analysis and feed policy making. So many of our decisions, especially because sometimes managers they cannot see violence as a public health issue, and we need almost like to fight some place between the infectious diseases, because they receive a lot of money. The area receive a lot of money because, and this is right, because this is something that can cause serious problems, especially to a country like Brazil. because it's a tropical country. There are many diseases happening all the time. Too many people living sometimes agglomerated. So it is important to prevent infectious diseases, but managers sometimes they don't realize how serious violence it is, and how much it costs. So through the data, through the data we collect, we analyze, we can show them, and then planning strategies to overcome the problem. So surveillance is both protective and also a planning tool that we have.
Thank you so much for diving into that. When you were discussing in your webinar how the homicide rates between Brazil and Canada, that was a really shocking fact to
Yes, it
hear.
is.
And I think that would have been one of the best things to show healthcare professionals like, yes, this infectious diseases is important to track, but so is violence. So thank you so much for kind of emphasizing that point again.
Yeah.
And I'm very curious if you can explain how the Brazil Unified Health System, SUS or SUS, is structured to both respond and prevent violence.
Mhm. So, as I told, SUS is a single unified national system that provides a lot of services, all for free. So I think it's the organization is based on principles, regionalization, level organization, and decentralization. I think decentralization, maybe here, and level organization are the most important because is how we keep this system working. Because if states and cities don't follow what the Ministry of Health is leading, is proposing, this wouldn't work. So I think the way it is organized help us to keep as one and help us to make better decisions. Uh, I'd like to highlight that although the Ministry of Health, because I also work at the Ministry of Health, but I work remotely because now I live in Vitória, which is very far away from Brasilia, which is the capital. But when I work the both levels, like the municipal level and the federal level, so I can see the challenges of the two levels. Because sometimes when we work at the municipal level, we think the Ministry of Health can do anything. Like, why don't the Ministry of Health fix this problem? But when we are there working, we see that this thing that seems small is actually very difficult to do. So, as more decentralized the level, more sometimes we can do. So, working at the municipal and at the federal level has allow me to see how this principle of decentralization and level organization works and how this is important for us because it helps us to keep all the system going, helping each other. Because it's not only the Ministry of Health talking how we should do things, but us as municipal levels, we also say to the Ministry of Health the reality, because sometimes when we are working at the ministry we are like in an imagination world that we forget how the practical things are happening inside the hospitals, inside the basic health units, inside the neighborhoods. So us, I say us because I work at both. Sometimes it's not confused, I hope, but it's for me it's like sometimes I assume a position, but as municipal level, we also say to the ministry about the things, and they listen to us, right? So I think the SUS is organized is based on these principles, and I think this helps us to keep this uh, large system going.
Mhm. Thank you so much for diving into that. It does sound like it's very intersectional collaboration as well, and like between municipal levels and the Minister of Health, and it has to work. We have to work together in order to solve this large issue. And you've emphasized intersectional strategies in this approach. I was wondering if you could share some examples of like how health, social services, education, and potentially the justice systems or sectors work together in this area.
Yes. So I'm going to say about Vitória, the city where I work. Here, this network functions very well, like very well. It's not perfect, it's a way to be perfect, but it's better than in many, many other cities that we have here in Brazil. And violence surveillance acts as an articulation between sectors, ensuring communication and referral flows and coordinating like the care. So I'm going to cite one example here in my state, as I told before, the schools, universities, basic schools, every type of teaching institutions, they must notify violence cases. They must report. And here in my city, there is a partnership between public schools and violence surveillance. So inside the education department of the city, they have a team responsible for um, receive the violence cases from schools. And this team, they are responsible for notifying and talk to us about the cases. Why this is important? Because the professor who are there teaching the 7 years, 8 student, they will not communicate with us, right? They will communicate to the education department, and the education department will talk to us and will talk to the social assistance services. So we kind of, this seems easy. This is something that seems easy, but it was something that it was a process. So the managers could make this happen. This makes difference because students who were underreported, they now have been seen, and this increased a lot of the numbers of students being notified. So this is an example of how this works, like education, social assistance, and health, because professors, they are not notifying, but they are discussing cases with this team located inside the schools, and then they are reporting, and then we are talking to make all care happen.
Mm-hmm. It's really good to hear about how there was a challenge in getting accurate student numbers and then getting people to be notified, especially like since professors weren't notifying, and then finding a way to report and have more accurate numbers. Um, I,
Yes.
I was really curious to hear what are some of the biggest challenges or gaps that you've observed in Brazil's system when it comes to addressing violence.
Um, oh, there are so many. But yeah, I think underreporting. So many cases never reach the system. So I showed you that over 600,000 cases were reported last year, but we know that this is so small compared not to what happens, but at least what comes to our health services, for example. So, and people, they don't report because sometimes they don't know. This seems like Mm, This seems like I don't know how people don't know about that, but they don't know. They don't know that this is how to notify, and they must do this, and they don't know how to refer the cases. So underreporting is something that we work to decrease. I think data quality too, because sometimes they even report, but they report everything wrong. So the
Mm.
data come incomplete or inconsistent, and we cannot use for all the data that we collect. Um, yeah, I think the integration between the sectors,
Mm.
maybe it's one of the worst because, okay, we notify, but what do we do with that? How do we refer this victim? Um, how do we protect them? We don't talk. Sometimes there is this difficulty to have workers, social workers to report. And there is a lot of problems and challenges behind, like our public administration. So We don't pay people to stay working at the same place for a long time. We don't reward them enough. So people are always changing. So we train the hospital team. 1 year later, there is no one there. We need to do everything again. So um, this movement of people of workers is very hard to is also a problem. And I think resources and infrastructure, there are places that only one person to handle all the notifiable conditions and violence. So this is not easy. Like in Victoria, we have a team, but this doesn't happen. It is a small team. We need more people, but financial resources are limited. So we cannot have many people working to it. So there are many challenges that we have and many gaps. For example, the information health systems, they don't talk to each other. So this is also a problem that now we are working on. We are having access to resources to make this happening, but it still is insufficient.
It's really unfortunate that as you're speaking towards the challenges in the different provinces, Victoria and Brazil and as a whole, that I'm reflecting in Canada saying, yes, high turnover is an issue when it comes to social services, and there is
Yeah,
going to be
exactly.
underreporting. So it's yeah, unfortunate to see the parallels between Canada and Brazil. But I am very curious to hear about your perspective of what are the most valuable lessons you've learned working and how that could be relevant to other countries like Canada.
I think a few lessons that I've been learning working at the federal and the municipal level is that surveillance must be sensitive, sustainable, and practical. So we cannot think on expensive solutions or, you need always to think what is cheap, what is practical, what it works, and it is sustainable. Inside the hospital, inside the municipal health department, all the time we need to think different ways. I think the other thing is primary healthcare matters. So family health teams detect and support victims early. Here in Brazil, although we have this primary healthcare well established, um, the source, uh, most part of the reported cases comes from the hospitals, not from the primary healthcare. This means that primary healthcare is not identifying, or if it is identifying, it's not reporting. So when people um, get to the hospital, it's because they are really injured, and then they notify. So I think primary healthcare plays a key role, and we need to strengthen. It's good, but it's not as good as it should be. And I think the other lesson that I've been learning is building partnerships. This is something we have to do all the time in everywhere. So reach out to unexpected allies and multiply capacities. And I think being patient and strategic. I'm not patient, but but I work with people who have worked like for a long time now in violence, and they are so patient. Sometimes I get frustrated when something doesn't go the way I want or at the time I want. And then I talk to them and they say, "No, Mayara, just calm. Everything will be okay. This is not the moment, but it's not a political right moment, but this will change. So be patient and strategic is something that I've been learning. And I think never underestimate local adaptation. Like I told you, sometimes who is taking care, they know what is going on. So sometimes like managers or in a different level of management, we don't realize what is important to who is actually taking care of the situation. So if I am a manager at the hospital, I need to go into the emergency room and talk to people who are there to understand what is going on so we can think together something. Not me as a manager who never went to an emergency care room and try to make change. So this happens in a hospital, but again, it happens from the Ministry of Health to the cities. They cannot, um, okay, they cannot, are you listening to me?
Yeah.
Okay, there was something went wrong here, but
Oh,
I'm back. They cannot define everything without listening to us. So I think this is important. Never underestimate who are taking care, who are in front. Sometimes, even as academics, we do this. We think the way we are studying is the best way, but we don't listen to people who are taking care. So never, never underestimate who are really doing what is doing.
that's a great lesson for everyone. Just like never estimate the people that are working so hard in this field and been working for a long time, and to take everyone's perspective into account when discussing new lessons and transforming new innovative ideas, but also being, as you mentioned, practical, sensitive, and sustainable. So thank you so
Yeah.
much. And finally, I wanted to ask you personally, you work in violence prevention, and I'm wondering what keeps you motivated in this challenging but impactful field.
So I think I was drawn to this work because I saw firsthand how many cases were invisible and how health services can be a place of protection. So working in a hospital surveillance, I realized that small changes that we do, a better report, a sensitive care, or sometimes just 1 minute more reading the medical records to understand better the situation is important. So um, sometimes small actions. We sometimes we look for great actions, but the small actions really care. For example, when I was working at the hospital, people were coming to my office, and I was teaching them how to fill the notification form one by one sometimes. And sometimes I train people like 10 or 20 people in a room. This seems small, but if one person is sensitive to identify, she can identify many people through their life, through her life, or his life, whatever. So I think what keeps me motivated is the possibility of making a real difference. Like I told before, we cannot save everyone, but we can save many people. So when I am training, 2 weeks ago, I trained, I don't know, 40 people about this topic. And I was like, why do you have to notify? Why you have to notify? Please notify. And I was explaining not because like one more work process that I have to do, but because this can give visibility, this can make people being seen. So that's why we notify. So I think we can't give up because there are many people who need what we are doing, and it seems like small seeds that we plant, but this will grow sometime. So as Brazilian, I can't give up. And we try again, and it's not the right moment. Okay, let's wait. This is not working. Okay, let's try again. But because of this, because yeah, I always think about children. So many children. I saw this so many times. Children who go to the hospital not only one time, but maybe 5 times, 6 times within a month. And then when they come back, sometimes they were um, in a, in a bad condition because they were abused one more time, or sometimes they don't resist, they die. This happens like one case like this in the hospital where I worked. The kid, her parents, they took her in very, I don't know, 10 times in a month in different health services. No one notified, no one realized anything, and she had died in the hospital where I worked. So I was wondering if they had realized at the first time, probably she would be alive. So that's why it's important to keep going, because I think health surveillance can be a key for to protect people.
Yeah, I totally agree. Thank you so much for diving into about how passionate you are about this work and how even if we impact one person, we're still helping one person and how impactful
Mhm.
that is.
Thanks for joining us on the Her Health podcast, transforming health for women and girls at risk. Remember, your health matters, and together we can make a difference. Until next time, remember to prioritize your health and well-being. For more resources and support on issues affecting girls, women, and gender diverse people, visit our website at avatraining.ca. This is Dr. Nicole Letourneau. Thank you for listening.